February is Heart Month, and today we're talking about two of the most deadly diseases in America and how we can keep ourselves and our loved ones safe from both. The CDC ranks heart disease and COVID-19 as the #1 and #3 leading causes of death in America, respectively. Joining me today, Dr. Heather Cha, who's the medical director at Ascension St. John Heart Failure Clinic and Cardiac Rehabilitation. Good morning, doctor.
Morning. How are you?
I'm doing good, and I wanted to start by talking about how the pandemic has affected you and your patients and heart care in general.
Yeah, no, we've been doing this for a while, and it's definitely required us to adapt. We do a lot of virtual now. We're all still wearing a mask in the office. We're all still socially distancing and providing that space. And so, yes, we've had to make some changes, but I think when I look back, I'm really proud of that fact that we've still been able to connect with our patients and provide them the care that they need. And so I'm proud of us and our community and our patients for continuing to place their health first.
Dr. Cha, I was wondering specifically as well about how do you see people maybe delaying care because of the pandemic, whether it be they're not getting out of their house, they come down with COVID themselves. Are you concerned about delayed care?
Oh, absolutely. And I think that's probably the biggest concern that I have in the pandemic right now is that I think people are worried about acquiring the virus if they come in. And so instead of calling 911 or coming into the emergency room, they're sitting at home with symptoms that are worrisome for heart attack or stroke, a serious critical medical emergency, and they're just waiting it out at home. And so part of the message today is come in if you think you're worried. To be very frank, I don't want anyone to die from doubt. I don't want people to sit at home and think, well, I'm having chest pain. It could be something serious, but I'm going to wait it out and then suffer serious consequences from it. Also, in medical emergencies like heart attack and stroke, time is key. Every second, every minute matters. And so I encourage everyone, if they have something worrisome at home, to not sit on it and to not wait and to hurry up and get in.
What are some warning signs, Dr. Cha, of you may be at risk for heart disease in your life?
So heart disease is this all-encompassing term, and there are different variants of it. So you could have had a history of heart attack. You could be at risk for congestive heart failure. You could have a valve problem, a rhythm problem. You could have a congenital problem, which implies that something is wrong, but that's something you were born with. And so it's actually fairly broad. But in the most general sense, risk factors for developing heart disease are things like high blood pressure, high cholesterol, diabetes, being overweight, smoking. And then there are factors that we actually can't control, and that's how we age, and then the genes that we're born with or our family history. But I also think it's important after that to share that so much of heart disease is preventable if we educate ourselves and we take action in advance to prevent developing even the risk factors that I mentioned.
What are some of the things that you like to leave your patients with, maybe after their first visit, things that they can start doing right now to prevent bad outcomes and to help their future?
Good question. So I think in this day and age, there's so much information overload. I try really hard to keep it simple. So as your physician, I want you to live, but I also want you to live well. And in the simplest sense, I think we can all, and myself included, do a better job of eating smart, moving more, and just living well. And I mean that last part in the sense of mental and emotional well-being, making sure we get good sleep, making sure that we manage stress well and in a healthy way, making sure that we're connecting with the people that we care about, especially now as we're distancing. And so I try to keep it really simple, just one day at a time, one thing at a time.
Dr. Cha, any last words before we run out of time here, just about heart disease, Heart Health Month in general, and what you'd really like to see Tulsa and Eastern Oklahoma do to eliminate this #1 killer in America?
I think that the final message, if I were to say in the simplest sense, would be educate yourself, ask questions, learn about your body and your own health, talk to your doctor, your healthcare provider, and then take the first steps to prevent bad things from happening in the future. And I think We should be doing that every month of the year. But yes, February is American Heart Month. And so if we can bring awareness and attention to it and get a jump start for all the people in our community who have yet to reach out to their doctor or yet understand what their heart health situation is, then I think now is the best time to do it.
Dr. Heather Shaw, Medical Director at Ascension St. John Heart Failure Clinic and Cardiac Rehabilitation, we thank you for your time.
Thank you so much. Stay warm and stay safe.